Hi, I'm Mandy Evans, your host for People Are Animals Too, darn it. Today, my guest is Dr. Chrissy Ponsness. Dr. Ponsness joined the Ponderay Vet Services team in 2013. She enjoys working closely with clients to meet the needs of their dogs, cats, and small animals. Her special interests include oncology, surgery, preventative care, and specialty care of the geriatric family pet. She completed her undergraduate education at Whitman College in Walla Walla, Washington, prior to attending veterinary school at Washington State University. When she is not at the clinic, Chrissy and her family enjoy most things outdoors, such as boating, fishing, hiking, camping, skiing, and snowboarding. And we are going to be diving into the subject of veterinarian suicide. Welcome, Dr. Ponsness.
Thanks for having me.
Yeah, thank you for joining us. So I think the best way to start is to tell us a little bit about you and how did you end up in this field?
Yeah, well, I think that I always enjoyed animals and specifically dogs. I did a lot of 4-H growing up with dogs, and my mom was a leader of it. It was something we were really involved in, and that kind of just got my passion started, and then also just a love of science. But I really didn't know, even going out of high school and into undergrad, what I wanted to do.
Wow.
And as I thought about human medicine and I thought about different science careers, and really it was more that bond that we have with animals that probably drove me this way.
Nice.
Yeah.
I mean, that's kind of our thing, is recognizing that human animal bond is so important. So you go into this business with this idea that you're going to be helping keep pets healthy and with their families. And what are the things that when you kind of left school and went into the world that you learned that they really didn't talk to you about in school?
I was just back at Washington State University, where I graduated from vet school, and I was meeting with some of the third-year vet students there, and they were talking to me about some of these programs that they have now to get them prepared for their career. And there's a huge emphasis now on communication and on working with the owners. And they're actually getting classes now on how to communicate with owners and communicate pets' needs and understand this bond that we have. And 12 years ago, there was none of that. And so I think that really answers your question of one of the things that surprised me was no one prepared me how to really talk to the people.
The people side of things. And I was told a while ago that veterinarians aren't taught really how to run businesses, when really primarily businesses or vet clinics are owned by veterinarians.
Yeah, it's very true. There are just a couple, maybe 2 or 3 now, veterinary MBA joined programs, so you can come out with that business degree.
Nice.
But it's pretty few and far between.
Yeah.
And you have people whose passion is the science and the medicine and the pets, and they haven't ever thought about payroll percentages and what it takes to run a business. And again, now there is a little bit more of that. Mm-hmm. There's the Veterinary Business Management Association that students can be part of, that you can learn from. But many veterinarians come out without a clue on how to do that.
Yeah. Not quite set up for everything that's going to happen. So the way that I look at it is when you have these wonderful people who have dedicated themselves to veterinary medicine. Not easy. I mean, they only select a really small group of people to even pursue it, right?
Yeah.
It's hard to get into veterinary school. We do not have enough veterinarians in our country.
Yep.
And so the need is there. And then you actually are thrown out into the world to help in a business consumer model. Mm-hmm. Like, how does that look from your perspective on how you come out with this idea of being helpful, and yet you're faced with this other side of it of having to make a living
right.
as well.
Yeah, it's an extreme challenge. It really is, because when we go to our dentist, when we go to our doctor, you don't generally ask your doctor, well, how much is that going to cost? Well, can you prescribe a different medication or run a different test? They don't present you with estimates when you're sick or ill or injured, and you decide whether or not you want care. And because the veterinary industry is that private pay industry, we're forced to do that. Mm-hmm. And so we don't get to separate the care and the recommendations from the finances the same way. Because of that, there's a stigma with that.
Yeah.
There's clients that believe veterinarians are just in it for the money.
Right.
Where, believe me, if we were in it for the money, we chose the wrong profession, Mandy.
Well, and there's a lot of easier things to do
right.
than to
spend 8+ years in school and work many hours a week. Yeah.
So I think it would be good if you were able to describe for people, like, what does that feel like, being a veterinarian who's dedicated yourself and your life to helping animals, having to balance that? What is personally, like, what does that feel like for you?
It's an emotional struggle, because being a business owner, I have a second responsibility, and that is to keeping the business open and to taking care of my staff and my employees.
Yeah.
And if I gave away services to everybody that didn't have the finances for them, I wouldn't be able to take care of my employees. So I feel torn.
Yeah.
I think that's a good word for sometimes how I feel. I feel kind of torn in two between wanting to provide the best medical care for that patient, but also having the responsibility of running a business.
Yeah, and those people are tied to families and the community as a whole. I can see that. So do you think that this battle between these two is the reason that we're seeing an increase in veterinarian suicide?
I think that's part of it. There have been some studies recently in the last couple of years that have tried to delve into this and tried to tease out the reasons the suicide rate has climbed so much. And just to put some numbers on it, I think the American Veterinary Medical Association statistics looked at female veterinarian suicide rate being 3.5 times higher as a non-veterinarian female in the same age group, and the male suicide rate being 1.2 times higher. So significant increases. And so trying to tease out the many factors has been a challenge. And a lot of it is what's being defined as compassion fatigue. And compassion fatigue has been looked at and defined a little more for physicians, but not as much for veterinarians in the past. And that idea of compassion fatigue is that we truly give ourselves to our patients and our clients all day long.
Yep.
And I'm very tied to my patients. I've been in this community for 12 years and, met you 11 years ago.
Yeah.
And so I see people's pets grow from the time of puppyhood and kittenhood.
Yeah.
And I bond with them and I give myself to them when I walk in the room. And even a pet that's the first time that I see them, I give myself to that client when I walk in the room. So my day may run the gamut of going in and seeing that new puppy and feeling that elation and excitement with you, or your nerves over how to raise that puppy right. And then going into a euthanasia.
Yeah.
And walking that piece with someone and giving them, the time and compassion and love that they and that pet deserve. And then walking out of there and going into the next room where maybe I have a client that's frustrated because they've had an ongoing condition, like a skin condition, that they've tried 4 different things and nothing seems to help.
Yeah.
So my day may go like that for 8 hours. And then I go home and give it to my family.
Yeah.
And so it does, when your compassion meter is, as much as you try to keep it high, it takes that toll. So I think that's one factor. Back to your other question then, when you look at the cost for services, when I give myself all day to a client and then I hear, well, that doctor, she doesn't care. She just wants money.
Yeah.
It takes something from you.
Yeah.
It takes something from that giving that you've given all day long.
Yeah.
And that's, it's hard. It's hard to walk away from that.
Well, and I think a good portion of our audience are shelters, animal shelters, and leaders. And I think that they can relate to that, because if something goes wrong, if we fall short, a lot of the time what we hear is, oh, those people that work at the shelter, they don't actually care. All they care about is making money or something. And you're thinking, I'm working 7 days a week where we have people. It
volunteers.
Yeah.
Yeah.
The other thing I hear, oh, Mandy, you need to grow a thicker skin. And it's like, no, because if I do, I shouldn't be in this business, right?
I agree.
Same thing for you. Like, if it doesn't bother you, and I will say that you were there when I had my best dog ever, and she died. And it was a horrible death and all of that, but you cried right there with me. And so I think that the other factor too is that, and we talk about this, is that showing emotion in that way and being vulnerable in that way, there are a lot of people where that is hard, and they believe that because they're the doctor or they're in this position that they shouldn't be. And that all gets bottled up and taken in. And then if we hurt people constantly when they're being vulnerable, they stop being vulnerable.
Yep.
And when you are putting yourself out there, what we want from you is to put yourself out there. Like, that's amazing that you care as much as you do about your pets. Like, that's what we want. But we can't expect that of people, and then at the same time completely slap you every time that you might fall short or something happens. I think it's just something we miss in the world, that we create kind of these outcomes that we don't want because of our behavior and the way we treat people.
And I think too, same, I know you experience it also as we do. Social media has made that so much tougher. And I think that is a big contributing factor for veterinary suicide, is now if you do fall short, or if someone misconstrues a circumstance or why something occurred, it's now blasted on social media. And so not only are you dealing with one client, but you're dealing then with everybody else they added to the situation.
And not to mention that you're a member of this community, or any community. Any vet is a member of a community, and now you've got 50 people jumping on, commenting, and you may not even know them.
Yes,
and
exactly.
It's your name or your clinic.
Yeah.
It definitely compounds into an unhealthy environment. I know I love Facebook, but boy, I dislike Facebook too.
It has changed, our lives. It's changed our children's lives. It's changed running a business and a career, and it does it in a lot of good ways too. But unfortunately, when it is vicious or misdirected, or a circumstance is misunderstood, it's very hard to stand up for yourself on a social media platform. And that's generally, I don't know if that's the same recommendation you've been given, but we're often given the recommendation of, don't stand up for yourself on social media. Don't say anything, because you'll come off looking defensive.
We actually, it's kind of sad to say, but we've become really good at it, because it doesn't happen very often anymore, but it used to. And so we just started responding, but fact-based. So this animal came in this, or owning it. Like, you're right, we did fall short here, and that has worked for us. So I think that when you look at the world of animals, even bereavement, right? Like, we say we don't provide people with bereavement when they lose their pets. So here we talk out of both sides of our mouth a lot, where pets are so important, and this is like a family member, and there's all of that. The pet market wasn't affected during the recession because everybody kept investing in their animals. We're doing all of this, and we know how important pets are. The Habry Institute is doing all this research to support the human-animal bond, but our community, our environment, our services aren't actually set up to truly support the human-animal bond. So we have health coverage, we have human services, things that will help people and their children get the services they need. We don't have that for pets. And I feel like who really does get the brunt of that, and all of this, just a ginormous amount of need is being placed on veterinarians. So I'm wondering, from your perspective, how do you see this changing? Like, what's our future? How do we change this model?
No, I think it's a great question. And of course, a lot of it's going to also come down to who's going to fund some of these changes.
Yeah.
You know, because you do have some pet loss bereavement things available now here and there. There's a pet loss hotline through Washington State University. There are some blogs and some websites set up now. But it does come down to that piece of who's going to get these programs off the ground and be part of funding them, because that's what it's going to take. There's people that are in need. And like you suggested, you know, as the veterinarian, I do get phone calls. I'll get phone calls sometimes 3 months after the loss of a pet. And I'll have someone say, Dr. Ponsness, is this abnormal? I'm still grieving.
Yeah.
Is this okay? I still think about if I made the right decision for her. Did I make the right decision?
Yeah.
You know, and I do everything I can to be there for that client. But I feel that I fall short there, that I'm like, oh gosh, I'm not trained in bereavement counseling, and am I telling them all the right things?
But I think it's sad that we have an environment where people have to feel justified in having feelings.
Right.
Like, I know somebody that will be very honest with me, and he said that the loss of his dog was more impactful to him than the loss of some of his family members.
Yep.
And so we just have this thing going on where if pets are so important, then there's not a lot of services to help people support the needs of their pets. So it's just I don't know the solution, because we have insurance. It's just not as widely. I mean, how many of you do you feel like your patients have
veterinary insurance?
Yeah.
You know, it's still a very small percentage. I would hazard to say, like, in that 3%.
Really?
Even.
That's
small? That's
Wow.
small. Most veterinary insurance right now is a third-party payee insurance. And so you pay your veterinarian, you submit to your insurance company.
Okay.
They then look to set up if you met your deductible and how the different products work and everything like that.
Okay.
And so it's growing, it's available. I think some veterinarians are resistant, and part of it is because of what we take from the human insurance company side.
Okay.
You know, there's some good and some bad there. Human insurance companies have dictated in a lot of ways how care can be given, and they've taken that out of the physicians sometimes.
Yeah.
So your GP or physician doesn't always get to treat you how they want to treat you anymore. They get to treat you how a corporation has chosen that your treatment plan should go.
Yeah.
And as veterinarians, we're resistant to allow that to occur.
Yeah.
You know, we want to be able to look at each patient individually, not as a statistic of 95% respond to this lower cost medication, so you have to start with it. You know, we like that freedom in treatment.
Yeah.
And so that's been a challenge, you know, where we want insurance for people, but we don't want it to change the face of veterinary medicine.
So how do we see, I guess, this idea of access to care changing for animals?
Yeah.
I mean, if we're not into, or if we don't want to support insurance companies or the insurance side of it, and I'm not saying that's what you're saying.
Right.
I feel like you're speaking in generalities. But if that's not the right avenue, and we do have people who are not able to have access to care, what's the solution?
Yeah, you know, I think a lot of the solution is some of the traditional models that are in place that we've gotten away from. Humane societies or lower cost options that can get some funding and some subsidies other places, I think can fill some of those niches too. Because at the end of the day, those veterinarians have to pay their staff, and they have to pay for their equipment, and they have to keep food on their own tables for their families. And so if there can be public programs to help meet some of those needs, that could help provide that level of care.
Yeah.
You know, we do, and a lot of veterinary clinics do have a kind of an angel fund.
Yeah.
You know, we call it our Funds for Life, where we do take donations and we do try to help people, you know, as much as possible. Now that money goes fast.
I was going to say, it could just be one, and just to paint the picture, because it is so complicated. Somebody finds a dog that was hit by a car, and like, just if you thought, oh my gosh, it's a golden retriever and I have to save this dog's life, that could like deplete, because we have a fund through our helpline, and the requests that we get, we really have to determine, is this life altering? If it isn't, we can't help you. But you have to be, because
$1,000 can go extremely quickly. And so the ability to help every pet is really challenging. So it's a tough thing. And it's hard too, because there's still a decision to own. I think for a lot of people that bond is so important, and I think everybody should own pets, because it does so much for our hearts and our person and our being and our bonds. But it is a responsibility. When we take on Juju, it's that responsibility to know that she's going to have some needs, and some may be anticipated, some may not. And so I think part of being a pet owner is a bit of responsibility too.
And I think that the people, we work with a number of wonderful people through our Pets for Life program, and we have one of our staff that is literally knocking on doors and asking people what kind of services they need. And a lot of the time what we hear is that people acquire pets because they show up. Friend or family had a litter or unplanned litter or something. So a lot of people who are maybe more in that low income bracket aren't necessarily seeking out pet ownership as much as being a warm, kind-hearted. We ran into this one man who, it was really moving, because in our environment, in our community, housing has gone up, the cost of housing has gone up, and there were a number of people who had been renting in his family, and as they were trying to sell, so all of these people were displaced, and this guy had, I think, like 7 dogs in his yard. And it was because, and he lived in like a single wide trailer, and he had invited all of these family members to move in with him in their time of need, because they had nowhere else to go. And here he has these 7 dogs, and some of them were not altered. And so we were like, okay, first thing we're going to do, who wants to get neutered? Let's help you. But it's that kind of mentality where it's really being met. It's trying to balance that idea that it's a choice and a responsibility with these amazing people who are stepping up and stepping in to help these animals. So is there anything else that you want to share, or more about the subject that you want just people to know?
I mean, I think on that, just that veterinarians are people too, darn it. And that it, your veterinarians really, they do care, and they do work really hard. And we stretch ourselves really thin, and sometimes when we can't do something, it's not because we don't want to. It may be that we're out of resources, whether that be our own time, or just how many appointments we can physically see in a day, or our monetary resources also. I was reading a statistic the other day, and the last, I think it was a 2016 study that came out and said most veterinary students are coming out of vet school $160,000 in debt. So you also ask kind of that place where maybe things can change, and that might be one of those places where things can change, because veterinary salaries really have not changed significantly. In the last 40 years, the percentage increase has not been high, and yet that graduating debt load has increased significantly.
And so has the workload. Like more pet ownership.
Yep. And so it does. It becomes this challenge for a new veterinarian to come out of school, pay back those student loans, work all the hours that they need to work, and pay their own mortgage, and so just kind of cutting that little bit of break, to those veterinarians, and understanding that they are people too, and they have emotions and feelings too, and they work really hard.
All right, so anybody that's listening, I'm making a request that you call your veterinarian and tell them how much you appreciate them. I would say hug your veterinarian today, But since we're in the middle of flu season,
Right.
may not be when this airs,
We
but
may not be hugging.
you know, be careful, be wise. But there are people who are dedicating themselves to taking care of animals, and they're humans, and we all fall short, and we all have great expectations and desires to do the right thing. And I believe that anytime that you can provide somebody with kindness, there's a high likelihood that they're going to turn around and do the same to someone else. So we can make a place a better world to be in if we all took a moment to realize that there are good people out there doing hard work.
I agree.
Well, thanks you
Mandy.
so much for joining me. I really appreciate it.
Absolutely. Thanks for having me.
Yeah.
Thank you for listening to People Are Animals Too, Darn It. You can send your questions or feedback to Mandy at peopleareanimals2.com. MANDY at peopleareanimals2.com.